Perceive, process, perform. Do you need inspiration for your practice, or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration.
My name is Vargas. I come to you from the University of Iowa. I am a faculty member at the university. I've been teaching for about 25 years. I maintain a private practice 2 days a week. 2 days I teach, and 1 day is kind of research, and I really love the balance of those things. Today I'm bringing you a little bit of tips for bonding. I believe that all restorations, whatever they are, aesthetics or functional, and the anterior and the posteriors, the basis for the longevity and success, and even just the aesthetic appearance, is bonding. So I think every dentist needs to know bonding. So I'm going to give you some tips through these next 10-15 minutes to improve, try to give you something that you can improve in your practice. So I'm going to give you some examples right here of aesthetic restorations that I don't believe you could not do it if you don't have very good bonding, or at least they won't last, you know. So this is like a situation with a patient with a class 4 restoration that she's unhappy because it looks grayish. So we change it. Again, we can do this minimally invasive dentistry because we have bonding and we can do a very good bonding. There's another case. It's a direct resin veneer in a very young patient. I liked a lot of direct restoration. So that's another case that bonding is unbelievable, invaluable for this particular patient. Now, I always get the question, how long these things last? Well, bonding should last very long if it's done well. So let me show you a case. Of course, I can show you through the years, but this is before and after. This case is, believe me, is 22 years old. So through the years, look at this. Look at the photographs. Look at those anterior teeth. Of course, they don't look as good. But 15 years later, this patient is still very happy and doesn't want to do anything else. I keep showing through the years. This is 18 years. And the last photograph that I have of her was this past December, in which is 22 years. Of course, it doesn't look as good, but if you do a good bonding, it should last you. Okay, so let me give you some tips. First tip I want to give you is you have to know how adhesives work. Because it's very important, because if we don't know how we're working and just kind of do what we do, it's not necessarily the best. So we have to understand a little principles of it. So basically, the basis of adhesive is that we remove calcium and phosphate and we replace it with something. And that is a monomer. And then we polymerize it with a light curing unit or chemical cure and become polymers. So really what you are doing is replace what is being removed. And that's exactly what an adhesive does, replace what does is remove. The better, more efficiently do this, the better is going to be the bonding. So whatever you do, you are a total edge or a self-edge dentist, you are going to do exactly the same. So you're a total edge dentin person, you are going to etch, then put a primer and adhesive, or you are going to do the etching and the adhesive in 2 steps, or if you are a self-etch, you are going to self-etch with primer and infiltrate with the adhesive. So you're doing kind of simultaneously this removing and replacing process. Or nowadays with this new generation of adhesives in which you can do all this simultaneously, but exactly all those works the same way, replace what you remove. So based on this, there are a few things that we also want to talk about it. Enamel is very different than dentin because an adhesive, it needs to bond to enamel and dentin. So basically they are different in composition. Enamel is very highly mineralized compared to dentin. It's not as highly mineralized. And the component on the dentin that makes it more difficult to bond is the organic portion, there's collagen fibers and water. So think about this when we're bonding because it's important. Enamel is it's a substrate that is more robust to bond to. So we know we've been bonding to enamel for 50 years, so it's pretty robust. We know what we're doing to it. Dentin is the one that is problematic, okay? And when we look at this, we also know that dentin is not the same throughout. And that's what it makes it difficult to bond to. So if I show you some images with my scanning electron microscope of the dentin, you'll see that this is dentin in the middle of the tooth. You have dentin that is superficial dentin, and you have deep dentin. So the adhesive has to bond to all these dentins, and all these dentins are very different. Even further, a class 5 or a fractional lesion is a situation in which it's very difficult to bond to. There are steps that we need to take to bond to that particular dentin. So, and of course, we need to remember that the dentin is a living tissue, of course. That's why you anesthetize your patient. My fourth tip is etch enamel. No matter what you use, whatever you are, a total etch or a self-etch person, you need to etch, completely etch, okay? Of course, you're not going to etch your dentin in the self-etch, but you want to etch your enamel. Always, always, that's the best adhesion you're going to get, no matter what it is. Always etch your enamel. Dentin is very different. Again, remember, dentin is a different tissue. Remember, as we explained, it has more water, has collagen fibers. So dentin cannot be etched for as long as enamel. Dentin only needs to be etched for about 5 seconds. Okay? What are we doing when we etch the dentin? Again, we are removing calcium and phosphate. But we don't want to remove a lot of calcium and phosphate, just enough that we can re-infiltrate and create a good bond. So if you look at the image, I'm etching, I'm removing the smear layer created when we cut the prep. And this is what we're doing. We open those tubules, right? If I show you a cross-section, in that cross-section you see that now pulpal fluid will come through the pulp and makes it much harder to bond to. At a higher magnification, you'll see what is left behind after you etch, this sponge, okay? And this sponge, it's kind of floating in the water after the etching. So if you etch for very long periods of time, this is going to be very different. The depth of demineralization is much greater as longer you etch. So it's much more difficult to replace what you remove. So again, when we etch, we open this dentin, the dentinal fluid comes out, we're trying to go down. So also it's important to understand that the deeper we are into the dentin, the more difficult it's going to be to bond. So again, don't etch your dentin for more than 5 seconds. So look at those two images. Just represents different etching times. I did this a long time ago when we believed that dentin should be etched 15 seconds. But look at the photograph on the right side. It's 30 seconds. So as a question to you is, where do you think and what situation do you think you have to replace more? Of course it's going to be in the right one because you remove more. But it's not how much you have to replace, it's how good you replace again. So don't etch your dentin for more than 5 seconds. So this is what clinically I do in my practice when I'm using a total etch adhesive. I'm going to place on my enamel. Once my assistant is ready to rinse, I'm going to, or 15 seconds has passed, then I'm going to immediately put into dentin. In less than 5 seconds, my assistant is rinsing. And that's the way that I will etch dentin for only 5 seconds. And of course, if you're not etching your dentin, if you're using a self-etch, you are just going to put them in enamel, rinse it off, and apply your adhesive. After we etch, we use an etch adhesive, we are going to leave the dentin moist. Why we leave the dentin moist? Why need this collagen mesh, this collagen sponge needs to be wet after we bond? Because if it dries, it collapses. Photograph on the left is very nice and moist dentin. You see the spaces in between. So you remove the calcium in between and phosphate, and then you can re-infiltrate it with monomers and resins. To the right, it's kind of a dry dentin. You see there is no spaces, you cannot infiltrate. That's what is important, to really leave that dentin moist. Now for a clinician, what really moist dentin means? The best example that I can tell you that I heard from Joel Berg from the University of Washington is, think about the beach. The wave comes in, wets the sand, the wave recedes and leaves this moist sand. So think about your cavity preparation before you place your adhesive is to leave it moist like the wave just has received, like wet sand pretty much. Your next steps will be then apply primer, and you want to apply multiple coats of primer. Because even though you etch 5 seconds, this process is time dependent. So 1 or 2 seconds is not enough to allow the primer to infiltrate. So look at the images. If you do not infiltrate that resin back, the water is coming from the dentinal tubules, is going to occupy the space that should be occupied by resin. And all of a sudden, you don't have a good replacement of what you remove, and then you got postoperative sensitivity, weak bonding. So that's not what you want. You want to apply your primer, multiple coats, to allow this resin to really infiltrate and fill all those spaces, like you can see in the image in the animation on the right side, is filling completely in. The same with a non-etching or with a self-etching primer. You want to apply multiple coats, so allow these to go through the smear layer, because remember, we have an etch. You have to go through the smear layer and go into very good substrate of the dentin. When you're doing this infiltration, it's a very good way to agitate your primer. So what I do, and what I recommend you to do to get better infiltration, is use little applicators. So when you apply your adhesive or your primer with this, you kind of do a rubbing motion. That really will help you to infiltrate this dentin, because kind of loosening that sponge and allowing you to infiltrate it, go down there in, all right? So after we do that, whatever again adhesive primer we're using, we are going to evaporate the solvent. We have to dry that primer. Why we have to do this? Because all these, whatever it's a primer, it's an adhesive of the two-step, or it's a primer or self-etching primer of the all-in-one steps, there is resins in there, alcohol, acetone, and water. The water, acetone, and alcohol will help the infiltration into the dentin, what we're talking about. But we don't want to leave alcohol, acetone, water behind. We need to remove it. So how to remove it? By drying, with a blast of air. Not really a blast, but a stream of air. So clinically, I will start about a couple of inches, light stream of air, and then increasingly the stream, until I'm really kind of forcing that water, that alcohol out. What is the best clinical indication you can find that you did a good job? Is if you pay attention when you drying a primer, it kind of moves all the way around. Moves around, and then as you keep drying and drying, this kind of keeps, instead of moving that much, keeps slowing down and slowing down and slowing down, and ripples will form. That's the indication that there are ripples and there's no movement, and it's shiny and no movement. That's the best indication that you did a good job driving the solvent. Okay? What else do you want to do? You want to always, after you apply your adhesive, the last step is apply your adhesive. So every time you apply an adhesive, you always want to light cure that adhesive. It's very important. I know people will say, well, I want to save 20, 30 seconds the step of light curing. So when I put my resin, that resin is going to light cure my adhesive when I'm light curing it. But it's not really true. What you really want is to have that adhesive already set, completely infiltrated and penetrated dentin or enamel, and light cure it so it forms a good bond. So when the composite resin shrinks, doesn't pull your adhesive from your substrate. Thank you very much for watching my inspiration presentation. I hope it helped you in your practice.